morning, everyone. We're very glad to have you today to launch the EIT Health WorkInHealth Foundation. I think you're all joining us from all over Europe, so we're very glad to have you. We will have soon Celine Carrera to do the welcoming speech to welcome you all and introduce the day of event. A few tips to make the event interactive. You can use the chat to introduce yourself, to get to know the other panelists and the other attendees. And as we go along the day in the panel sessions, use the questions tab to ask questions all during the panels, and we will take them. We will ask the panelists all of your questions. So without further ado, I'm introducing Celine Carrera, Director of Education of EIT Health and Chairperson of the WorkInHealth Foundation. Celine, the floor is yours.
Thank you, and good morning all. I'm really glad to welcome you to the launch event of the WorkInHealth Foundation by the EIT Health. We're in for a day of insightful discussions and dialogue around the skills and talent gaps that the health sector faces. EIT Health is a multidisciplinary network uniquely positioned to address these challenges with its community of over 160 partners across Europe, leveraging the best assets to foster innovation that matters to patients and operating at the crossroads of education, business creation, and innovation. But let me share a few words on the underlying issues at hand. There is today a clear need in Europe to create the conditions of new job roles and profiles in the sector. Indeed, we've all witnessed the 2020 global pandemic has forced public and private institutions to face the talent crunch problem. Research had already underlined the vitality of the health sector, with 690,000 positions to fill every year in Europe. This is coupled with a shift in skills need, with the creation of many new roles, especially involving commercial, digital, and innovation skills. The pandemic has accelerated the shift. Skilling, upskilling, and reskilling are to be reinforced to support technological and societal challenges that will make the European health systems more sustainable. Somehow, the health sector is not sufficiently attractive for talents and graduates. Indeed, the Universum Global have released their annual report this year, the world's most attractive employers report. And interestingly enough, in the Global Engineering Ranking 2021, Google, Microsoft, and the BMW Group occupy the top 3. The first pharmaceutical companies ranked 25 and 45. Also to be noted, the AI revolution accelerates the creation of profiles able to master the science of data. An estimated 50% of existing work activities in the pharmaceutical and medical manufacturing industry could be automated. In 10 years, more than 90,000 jobs could disappear, while a different set of 90 to 120,000 jobs may be created. Over the next decade, pharma executives expect an annual increase of 27% in the percentage of role affected. Yet only 1/3 of the companies surveyed have launched reskilling efforts. Also, the very insightful Topol review suggests there's an urgent need for health systems to attract and retain such scarce and valuable talents, for example, by developing flexible and exciting career path and clear routes to healthcare leadership roles. If Europe is to maintain a vibrant and viable healthcare sector that can lead in innovation, we must rise to the challenge of recruiting and educating the best talents. So as a response, EIT Health is launching the WorkInHealth Foundation to attract, recruit, train, and retain talents. We want to federate collective actions to boost the competitiveness of healthcare innovation across Europe. So we are actively looking for donors to support the foundation's kickoff, as this is a collaborative effort. And today, through the 6 roundtables, you will get a glimpse of the activities the foundation will spearhead. panels will share their views with you on the hiring challenges that startups face to sustain their growth, young talents' perspective on the health sector, what it takes to move to a high-value care model in Europe, how the biomanufacturing sector faces an urgent talent crunch, how to close the digital skills gap, and the challenges in attracting and retaining skills in the space of regulatory affairs. Together with the WorkInHealth team, we are very grateful for your presence today and for your support in this journey. I now leave you in the hands of Claire Nassier, our WorkInHealth lead, to introduce the first roundtable. And I invite you to engage actively in these sessions, as it is the best way to make the most of this event and to reach mutually beneficial outcomes. I wish you a very enriching and fruitful day of dialogue. Thank you very much all.